No, that's the part I like the best.
The booth used to turn on your show. See that I have. It's kind of embarrassing, actually.
You've been working with Mr. Red now for 5 years. Do you notice?
Hey, Jack,
Yes.
you know something?
No, what's
I'd
that?
like you to meet Raymond Bailey. He
Climactic
plays...
scene to that movie, where 007 is fighting his arch enemy on top of the Golden Gate Bridge.
We're talking to Dr. Doug DeSalvo, who wrote a book called Back to Optimal Health, how chiropractic care adjusts your pain, reduces stress, and helps you get your life back. All in one book. Is that right, Doug?
Yeah, that's right, Jack.
You know, tell me about the factors that brought you into chiropractic.
Oh, wow. When I was about 20, 21 years old, I was really distraught with regard to what I wanted to do with my life. And it just kind of came to me one day that I wanted to help people. And then the question I asked was, how are you going to do that? And the word chiropractic came in my mind because I had been treated before when I was about 15 years old.
Yeah, you must have had some experience in
Yeah.
that, otherwise that just wouldn't have automatically gotten to your,
Right, yeah.
your
Yeah.
brain, right?
Well, my mom was a chiropractic assistant when I was,
Oh, I see.
when I was
Yeah.
13. Yeah, and so her chiropractor treated me for a lower back condition that I had from sitting in those chairs in middle school, which were plastic, and I always slouched in them. So I had lower back pain, and he cured me of that.
Right.
Yeah.
Well, it just so happens we've got an example of a spine here. Maybe
Right.
you could give us a little demonstration of that.
Yeah. So there's 24 movable bones in the spine, and there's the cervical spine, the thoracic spine, and the lumbar spine. And what I typically show patients is that it just has to get out of alignment like that to cause pain. And what will happen is that the joints of the spine will get jammed, the nerves will get irritated, and then the muscles go into spasm. And then there's a loss of circulation to that area. So the nerves are what is causing the pain up to the brain, and we perceive that, and then we send messages back down to create even more tension and stiffness.
Now, you mentioned something that interested me. You said the lack of, it affects your circulation.
Right.
Can this cause like numbness in your legs or your feet or a combination of things like that?
Yes, the numbness is typically due to a nerve irritation
Right.
or a pinching, but there's blood vessels around that nerve as well. The most common condition that causes sciatica, which is either pain or numbness down the leg, is a herniated disc.
Uh-huh, okay. Once you have a herniated disc, is there any cure for that?
Sure. Generally, we try conservative measures. For instance, if the spine is putting pressure on the disc, we want to alleviate that pressure manually or with traction techniques, what is now called spinal decompression. It's an intermittent motorized traction. That takes pressure off the disc. We can also co-treat with medicine. I often do that. I have a team of doctors that I work with, whether they be a neurologist or an orthopedist. We have an MD at our office as well. So I like to co-treat because sometimes patients need the best of both worlds.
How much of the problem that people have with their backs is genetic?
There are different genetic conditions, not as much as you may think. There's genetic conditions that could cause narrowing of the spinal canal, which we call stenosis. So we can take an x-ray of a younger individual and see narrowing through measurement.
As we get older, obviously we always experience more quote-unquote aches and pains.
Correct.
And a lot
Yeah.
of it comes from the back. We understand that. Are there ways that people in their daily lifestyle can help avoid the back problems that people normally might get?
Sure. Well, obviously, eating right is very important because...
Eating right?
Yeah.
Really?
The most common thing that we hear about these days is an anti-inflammatory diet.
Right.
That people should be adhering to because inflammation causes a variety of different issues, whether it be pain and stiffness or even cardiovascular disease. So I always tell my patients that they need to look at changing their diet if I know or they tell me that their diet may not be
I'll bet people are surprised to hear that, aren't they?
A lot of people are, right.
Yeah.
The standard American diet is fraught with all kinds of inflammatory foods, whether they be breads and sandwiches and sugars and cereal and things like that.
A lot of times people get the wrong perception of what a chiropractor does. Number one, why is that? And secondly, how do you overcome that kind of negative perception that people have?
Okay, that goes back to the early 1900s when the chiropractic profession was essentially formed. The first college was actually started back in the late 1800s. As the chiropractic profession grew, the educational standards were probably not as adequate as they are now. And the medical profession were at odds with the chiropractic profession. So back in 1963, the American Medical Association formed a committee to what they called to contain and eliminate the chiropractic profession. And they thought that they were actually giving us too much credit, and then they eventually called it the Committee to Contain Quackery. So they enjoined acupuncturists into that as well. And some chiropractors found out about that, and they sued the AMA. And in 1987, it was essentially all cleared up because the AMA was in violation of antitrust laws, or found to be in violation of antitrust laws by a superior court judge.
Okay, over the years, has the treatment that chiropractors give, like yourself, has that changed?
Well, our graduation requirements have improved dramatically. It's a 4-year postgraduate program with a 1-year internship. There are 4 national board tests that all doctors have to pass. We're licensed in all 50 states. The problem is that medical physicians generally don't know a whole lot about what we do.
Right.
So what they will do is typically stick with their traditional referral patterns or treatment patterns, which is here's some medication and then go to the physical therapist. And don't get me wrong, physical therapists are great. But what they typically go toward or treat with is exercise. And if the patient has a misalignment of their spine, the exercise can actually aggravate it. So I typically get patients who have been through that typical treatment plan, and they come to me and say, the medication didn't work and the exercise or physical therapy didn't work. And then they come to me.
Okay. Where do you get your background to go into business?
Okay. So a little bit about the training. The first 2 years are essentially revolving around the basic sciences, which essentially mirror general medical education. If you compare the hours side by side, they're almost identical. Okay. And the last 2 years are all about diagnostics, and understanding the variety of different medical health conditions that patients may present with. As far as therapeutics are concerned, the chiropractic education is all about manual medicine. So we learn manual medicine with our hands and also using different physical therapy instruments or instruments that will also work with taking tension off the body.
How much of the treatment that you give, is the treatment of the thoughts of the people, the psychological parts of it, as well as the physical?
Sometimes I will detect trust issues. A lot of patients have trust issues with any kind of doctor. And it's important for me to understand what's going on in their life, what's going on in their family life, what kind of stress level that they have at work. I will often ask them on a scale of 0 to 10, where's your stress level? I often get a 7, 8 to a 10 or 12. So yeah, if you understand their stress level, it's important to give them advice such as doing things like meditation. Do you ever do meditation? It's important to do that just to quiet the mind.
And are people surprised to hear that?
A lot of people are. A lot of people don't do meditation. My wife is an excellent meditator, and she coaches me too. I can always do more meditation.
Does she have to meditate a lot because she's married to you?
Maybe so.
Just a personal question I thought I'd ask.
So actually, she's taught me a lot about coaching my own patients. So it's great to have her feedback in that way.
If you've had a stress in your life that you've had to deal with, were you able to do that, do you think, effectively with your patients? To let it go effectively with your patients?
One of the things I was taught early on in practice was the acronym PTC, Present Time Consciousness. So it's very important that when I'm with my patient that I am with them and only with them.
Yeah, everything else is blank.
Right.
Okay.
Yeah.
The 3 things, 2 or 3 things, 4 things, whatever, cause the most problems, create the most problems in someone's back, in your opinion, are?
Biomechanics or ergonomics, how you sit at your desk. What we call text neck now. How many people do you see looking down at their phone?
A lot.
Yeah. I was at a hotel in San Francisco yesterday walking around the lobby, and there was a gentleman just slouching terribly in the chair in the lobby. The other 2 people were looking down at their phone, and that constantly strains the neck.
Mm-hmm.
Okay? Sleeping in an awkward position, or a sport, athletics, or lifting a heavy weight. Even exercise or where you're using barbells or dumbbells,
Right.
and it's too much weight.
So the advice in general for people who are looking, or who are healthy and not having back problems, the way to avoid those back problems are some of the things you were just talking about.
Correct, and I often recommend get into a chiropractor and get your spine checked, even if you don't have a problem, to determine what your baseline is, okay? And this is what I wish parents did for their children when they're young. They should get their children checked by a chiropractor, and at least yearly, unless there's a problem, then it should be treated. And this is a fundamental misunderstanding between our medical physicians and even parents. A lot of patients or a lot of parents will bring their children to medical doctors for a neck or a back issue, and they're given an anti-inflammatory. We have a huge epidemic with opioid overdose or overprescriptions, and medical physicians know that, and they're trying to get their patients off of opioid medication.
And how does that affect the back?
They're addicted to the medication, which is toxic to their body.
Right.
It may be relieving back pain, but it's not curing it.
Okay, so
Okay.
you're getting relief, but it's not really helping.
Right. Not in the long term.
In the
The
long
spine
term.
can continue to degenerate if it's out of
Yeah.
alignment.
Yeah.
If the spine were out of alignment and the medication was masking the symptom, what is that doing for the patient?
Yeah.
They're just getting a toxic substance put in their body.
Okay, I walk into your office, you've never met me before, and I say, Doctor, I've never had a problem with my back, and I want to stay that way. What should I do?
Well, I would say let's examine you first. Let's see what's going on relative to your balance and posture. And if there's no problem, then I would be making sure that you're doing some exercises for your back.
So if you can summarize yourself, how would you do that?
Well, I tell patients, number one, that the chiropractic profession is that branch of the healing arts that evaluates and treats structural problems of the body, particularly the musculoskeletal system and specifically the spine. And my job is to evaluate and detect misalignments of the spine. And when I do that and work with them, I make patients feel better.
Yeah.
I also give advice on what they could do to prevent it, exercises that they can do. And so many patients are asking me about what's the best bed. We got into the bed business and recommend a bed called the IntelliBed, different things like that.
Yeah.
We also provide a weight loss program to help people who are overweight, which will dramatically affect their musculoskeletal system.
It sounds like you're covering all the areas that can be harmful to someone's back,
Correct.
right?
Yeah.
Okay. Nice to talk to you, Doug.
Thank you.